Today we have a very special guest, Dr. Lisa Radosta, who is president of the American College of Veterinary Behaviorists. The ACVB is made up of veterinary specialists who lead the field in understanding animal behavior and promoting ethical science-based practices. Dr. Radosta is widely respected for her straightforward approach in helping pets and their guardians. Welcome, Dr. Lisa Radosta.
Thank you. Widely respected. I'm always like that. Okay, thank you.
Oh, yeah, believe me. I mean, you're a very valuable figure in the animal behavior world, and we're very lucky to have not only you, but the college as well, who has been very revolutionary in modernizing the animal behavior field, and someone that I know Bree and I take a lot of guidance from when it comes to how we treat animals and help the public at the same time. So as a veterinary behaviorist, you have a very unique perspective on dog behavior.
You have to know how learning theory applies to all animals. And so when I look at a patient, it's sad, but it's true that often I and people like me, right, in my profession are the last stop. It's not unusual for me to hear, I'm going to euthanize this dog or cat if you can't fix the problem in X number of days. That's not even odd to hear that.
Wow.
So these people feel desperate. And so we have to look at the whole pet. And we also have to understand learning theory to the point of like, when you first start training, I was 18, I first started training my dogs. Like I trained my dog when I was 6, but I mean like really showing them. I'm 55 now, so it was a long time ago. And I learned the 4 quadrants. I learned about operant conditioning. I learned about classical conditioning, and they seemed really separate because that's how they're presented when you're a new trainer. And that's probably how you should learn about them as a brand new trainer. But then you learn that they're really never separate. No matter what training method you're using classical conditioning and operant conditioning. Okay, so as a vet behaviorist, now add on the layer of whenever you condition an animal to do anything with operant, classical, or as I just said, it's almost always both, you change their brain. That's the part we have to know. You change the connections in the brain. You change the way neurotransmitters are firing. One of the coolest things is that I came across a study, I would say about a year ago, maybe a year and a half ago, that shows that in the brain, when fear, now granted this is rats, but rats are mammals, right? So when fear becomes generalized, some of the neurons in the brain actually change the neurotransmitters that they are secreting. So that's like saying, my eyes are hazel today, and when fear generalizes, they turn blue. Like the opposite happens. So that's the stuff that we have to know, right?
Yeah, well said.
Wow.
I mean, I was unaware of a lot of that. That's really interesting. It's no surprise, but I mean, it does seem like we're really coming into an era of new science as well, where we're starting to understand a lot more things.
I thought it was so interesting how very quickly when we started talking to you about being a veterinary behaviorist, you talked about the last stop before euthanasia thing, because that's such a common talking point. We hear that a lot in the dog training world, usually as a justification for punishment. And it was kind of validating for me personally to hear you immediately say that, because I'm like, what about the behaviorists? There's people whose specialty it is to actually figure out the underlying reason for what's happening with your dog rather than just trying to suppress them. So that was nice to hear.
Yeah, I think we're all in the same boat in a lot of ways. I think that we may have different core values or whatever, but I think a lot of us are in the same boat. I think if we can find the seats on the boat that are next to each other, we're probably going to be better off than if we continue to try to push people off the side of the boat, if you know what I mean.
Yeah, there's been a lot of research in how aversive training methods like shock collars, like prong collars affect dogs. What does the current scientific evidence tell us about the methods and how they impact stress levels, emotional health, and things like that? Why are these methods that we see so commonplace in the dog training field? Why are they, or are they harmful? I'll just go from there.
Yeah, so I don't think that there's the camps who are going to say aversive, and aversive is like, aversive can mean just things you don't like, right? Like, so let's be clear, things that work by causing. So not that cause, because I want to set aside the argument that even a buckle collar can be aversive. Yes, it can be.
Right.
So I'm going to say tools that work by causing pain or startle or fear. Like that is how they function to change behavior. So we avoid using those things because specifically shock. So not as much research on choke and pinch, the choke collar research is mostly about effect, like increase in ocular pressure and things like that, right?
Mm-hmm.
So we're really looking mostly at shock. There's a wealth of research on shock, and there isn't a study that shows that shock causes the same amount of stress or less than positive reinforcement. So what I'm saying is, the opposite way, there isn't a study that shows that shock isn't more stressful. This is separate from whether or not shock suppresses behavior, because I don't think anyone's going to argue that it can suppress behavior. If you beat a child, you will suppress its behavior.
Mm-hmm.
So we know that things that hurt suppress behavior. The question is that the way we would want to parent a child, right? Right?
Mm-hmm.
Wouldn't we want to parent our child in a way that is effective and the least stressful? Because we know that the more stressed you are, the less you're going to be able to acquire new skills, right? But the more stressed you are, the more quickly you will acquire traumatic memories, okay? All right. So even the study that I see people grasping onto, which is the recent predatory chasing study that used shock and also used positive reinforcement. So even in that study, the dogs were more stressed. There's not a question of the stress. So what I kind of always say to people, if you had a choice, this is what I say to veterinarians, because I'm still overwhelmed that they would recommend methods that aren't scientifically valid, but whatever. I say to them, you have two pills. You got a dog in front of you with a urinary tract infection. One pill has a possible side effect that the dog could gain some weight, but you know that if you modify the diet, that the pill will be highly effective and the dog won't gain weight. The other pill has the side effect of potentially traumatizing the dog permanently, and we know that the adverse event of increased stress behaviors is highly likely. You got two pills. Which one are you going to choose? No veterinarian in any country in the world I've ever lectured chooses the pill with more side effects. So why do people choose that pill, the shock collar, as opposed to the food? They choose it. This is what I explained to, I met with, how could I not, an important person in the dog training community recently. We had a meeting. And this is what I said to this person. I said, people you grab for those tools under very few conditions when they're scared, right? Because when you're scared, you feel desperate. So you grab something that maybe even doesn't fit with your core values. I have lots of clients who have said to me, I couldn't believe I put that shock collar on my dog. I didn't know what to do. So you're scared. Fear is not the best time to make a decision, okay? Number two, you're outside your skill set. To me, there's only two reasons why people go to that, right? It could be that you're scared that you'll lose your business. You're putting your kids through college. You're a shock collar trainer. You don't want to explore another way because you've got to make rent. This is the reality of life. You've got to pay for your kids, right? So it's fear and it is outside your skill set. And those are both fixable problems, right?
Yeah, well said, well said. And as you know, with our advocacy, I don't know how close you pay attention to it, but we always really try to differentiate because we're trying to clean up the professional dog training field and try and get these methods out of professional dog training because there's no evidence that we're of to support their use over other methods. But we always make a differentiation between the general public and professionals who should be held to a higher standard. So sometimes I want to make it clear whenever I'm talking about this, at least for me, I'm never judging the public who may use these devices. They're probably doing the best by their dogs in their own mind, but it really speaks to professionals who should have a higher level of competence to be able to help the public through these methods without having to rely on pain and fear. So I just want to have that in there. Did you have something you wanted to add?
Well, I was just thinking, as you gave those two really good reasons that people, might use some of those more punishment-based methods. We know that learning applies across all species, right, including us. And so Zach and I frequently remind ourselves how when you punish a dog, it can reinforce you. Because if your dog is doing something that's aversive to you, like if your dog jumps on you and it hurts and they scratch you and you knee them in the chest or something and then they stop, you, the person, just got reinforced, right? Because the aversive thing stopped. So that that punishing behavior is reinforced in us. And I think that's something that is important to be aware of and be careful about, because it can be easy to just feel either afraid, like you said, or stressed or frustrated or just like so irritated by whatever's going on around you and forget who the learner is.
Yeah. Yeah. And I think that also power is a dopamine rush. And I don't mean to say that pet parents are interested in power, but so I recently read this book. It's not a new book, but it's called The Body Keeps the Score. And it's an extraordinary book, like for anyone who appreciates trauma and science and learning. It was written by a psychiatrist. And so anyway, he talks about early in the book, he's a young doctor and he is dealing with patients in a hospital who have to be restrained. And he's so raw. He's so honest. He says, and basically I'm paraphrasing, I'm ashamed to say that restraining the patient, so 3 people lying on top of a person to get an injection in, to sedate them, gave him a weird sense of power and pleasure. And I see this all the time in the veterinary hospital. Now, if you read this book, you'll know how empathetic this man is, how close his family was to the Holocaust, and how deeply he was, like, this is an empathetic man. But even he was not, let's say, affected by this. In veterinary clinics, when we hold animals down, the veterinary profession doesn't hate animals, right? We love animals. But when you hold them down, there's a sense of accomplishment, of power when the thing gets done. And I see that unconsciously in some of my clients too. And it's not that they're bad at all. They're good people, or they would come to see me if they weren't good people. But I think we have to be very careful about that interaction. I've controlled that thing so I feel powerful, right? And my video that it's going to go up on, I think it just went up on YouTube, and it's going to go up in social at some point. I talk about possessive aggression and how the first step is to take your big fancy ego and put it over here, right? And because like you say, it's very reinforcing to beat somebody at something, to get the bone from the dog, even though they're growling at you, right? Like, so we have to be very careful. I think your point is so important that we're being trained too,
That's really insightful, because people do get dogs, even in the more wholesome cases, it's an ego boost. Like, we're proud of our dogs, right? Whether it's because they're extremely adorable and that's enough, or like in Zach's case, he used to travel around the country doing stunt performances with dogs at state fairs. And so they would do like these radical tricks, totally crazy things. And that's got to be a power trip. Like, for me as his partner, that's a power trip to be able to see those like amazing, incredible things that he was able to teach that dog. It must feel so awesome. Like, I think it's like pride in the best way, but then, I see what you mean. I see how that same feeling like crosses over all types of control or behavior, because behavior change is ultimately control too. Dogs can be happy about it, but you're right. We have to remember who we're here for, I think, at all times.
Yeah, if you think about it too, like you and I have done a lot of work on really trying to understand the history of problematic treatment of dogs in particular, and really understanding that. And part of our culture really does value power and domination over connection and communication as well. And a lot of that's just how we were raised, and we don't even know that is off, maybe. I think it's multifaceted for sure. But yeah, that's a big part of it.
Can I ask, before we move on, I know that you also have a dog training career in addition to your veterinary behavior career. Could you give a quick rundown? Because I think that's so interesting.
Yeah, before the comments say, hey,
Dr. Lisa doesn't
she doesn't know
how
to.
Yeah.
She doesn't know how to train a dog.
Vets
I'm
can't train dogs.
Yeah. So, so I come from a chaotic childhood. And so when I was 6 or 7, I was in 2nd grade. So finally my mother reneged and let us get a black lab puppy. So that was my first kind of like I like training things. Like, I enjoy this. So then when I was 18, I got my first Rottweiler. So it's the first dog that I went with my hard-earned money and got. And so we showed an obedience, and that really just brought me so much joy. I've really never been an agility person. It just wasn't, I don't know why. It wasn't a thing when I first started, and I was already in love with obedience. So then my girls, my Rottweilers, we did obedience, we did herding, which we never showed in because the girls use their mouths too much. The herding instructors were not thrilled to have a Rottweiler there anyway, and we did tracking, and I did nose work with my lab later on, Maverick, who passed away last year. So that's kind of I've always been doing stuff with my dogs. I stopped competitively showing when probably I would say somewhere around, like, when I got out of vet school, did my internship to somewhere around 2000 is when I graduated. So that's a while ago. So I started teaching reactive dog classes then because I love training animals. Of course, I had a horse, so I trained my horse. Clicker trained him and rode him and hacked around on the trails. So I trained my cat and I trained birds. So then I taught reactive dog classes for, I want to say, 10 to 12 years. We did 2 a night, and that was a huge learning experience. Yeah. Huge learning experience. And I just love that. And so then by that time I was already a veterinary behaviorist. And so I would make training plans for my technicians. And then I eventually started referring out to this little bubble of dog trainers I have here who I love. And so I work with them. And then some animals I still train on my own. Like, for example, sometimes I'll have a client with just a history of going even to good dog trainers, but they've lost their trust for whatever reason. So they say, I only go to you. So I'll act as their trainer, and I actually love doing that. So they come to me and I do the training sessions. And yeah, so training, and I've had the opportunity as a vet behaviorist to train, cockatoos and macaws and budgies and clouded leopards and cheetahs and like whatever people can bring to me. Raccoons. Oh my God. Raccoons.
People bring you raccoons?
Yes.
They're so
yes.
cute.
They're so cute.
They are.
It was really an experience to train a raccoon. This was just 2 years ago, probably somewhere around 2 years ago. But from your studies about raccoons washing coins, like, that it's innate behavior to use their little paws. But when you train one, it becomes so apparent because as soon as, like, you maybe would want to lure a dog, and you could even lure a horse. Like, you can lure a lot of species, but luring a raccoon is challenging because they don't follow with their nose first. They reach with their paw first. And so the methods that you might use to train a lot of mammals, even a bird, an avian species, didn't work with a raccoon. I had to think about, how am I going to get this raccoon to do what I want when he probably could, but it would be a lot more work to teach him to follow with his nose. I'd have to teach that behavior first, right? So I abandoned luring. I think you can always go back to shaping, right? Yeah. You can always go back to shaping, get your hands off the situation. So that is my training. And I was just telling you before we started, that is my happy place. Like, training animals, there's something that feels easy and comfortable. Not that it always is easy, but it feels so comfortable, to instruct animals on how to do things and to watch them morph into something special. So yeah, that's my training career.
When you were training as a young woman, you mentioned you were 18 when you got your first Rottweiler. Were you using more aversive methods back then? Okay, and so
Hell yeah.
would you say you were like using compulsion methods or?
Oh yeah.
Okay.
So I was 18 with this Rottweiler, and I went to basic obedience classes, right? And positive reinforcement training existed because people were training whales and whatever. Like, obviously there was that, but in the dog training community back then, it didn't really exist.
Right.
The closest we got was there was a trainer, her first name was Terry, I can't remember her last name, who held treats in her mouth and spit them at the dogs. I did this, but the dogs wore pinch collars. So you would, like, correct and then you'd reinforce by spitting the food and the dog would catch it. The idea that if the food was here at your face, the dog would look at your face. So I've been really honest on social media. So I used pinch collars. I never was presented with an opportunity where I said yes to a shock collar. So I have never done that ever to any animal, used any sort of shock, but I used pinch collars, and there was a particularly awful way of teaching a dog to pick up a dumbbell, because in open and utility, in the obedience ring in AKC, they need to pick up dumbbells. In utility, they scent dumbbells. So you want to really solidify the pickup in open, because in utility, they're going to go and scent across the ring from you and then have to pick up. And so instead of us teaching it the way I've taught it to my second and third Rottweiler, the first Rottweiler learned it with an ear pinch, where you take the pinch collar, the clip of it, and you put it against the dog's ear. So the dog's ear, the metal, and your finger. That's what we taught dogs. Yeah. I know, Bree. I know.
I've never heard of that before.
Because it's so dang
old.
Though. Yeah. So we did that, and then I remember one day. So there was this thing called a sneak away. It might still be a thing. I don't move in those circles anymore. So your dog is on the pinch collar, and you ask the dog to watch you, and there's a person over on the other side of the dog trying to distract the dog. And when the dog doesn't watch, because he's learning and he's messing up, you sneak away, which means you take all your weight and you jump away, which you know what that does to the dog. Right. So I did that. And I burst into tears in front of God and everybody. Burst into tears. And there was a new trainer. Her name was Diane. And she had a Tavern, Belgian Tavern. And she had just started discovering positive reinforcement. She was like on the fence, like, how do I go from this to this? There was just nowhere for us to learn. Right. And people were laughing at me. And I was bawling. And my dog was like, you hurt me, but you're bawling. And I don't know what to do. And we're all... And Diane looked at them and she goes, you can stop. She's like, you can look at Lisa and you can see that this is completely traumatizing to her. Like, you guys need to stop laughing. And that was the turning point where I was like, I don't know what to do, but this is not the way. Like, I can't do this, because for me, at every low point in my life, there was a dog that lifted me, and this dog had lifted me. Wow. So Diane kind of took me under her wing, and we kind of, I don't want to say discovered together, because she knew so much more than me, clearly so much more. So she discovered, and I was on her coattails, that there was a better way. So when the second Rottweiler came along, I had my spreadsheet. I was like, these are all the behaviors I'm teaching. This is exactly how I'm teaching it. I promise you right now, you're never going to be hurt. That is not going to ever happen. And, from there, it just took off. Because once you hurt your dog and you see that you've hurt them, like, how can you do that again? Like, you can't do that again, right? So I'm not happy. I'm not proud that happened, but I don't shame myself, because that allows me to really see both sides. And it allows me to say, I've done what you're doing. And I remember being on a podcast before podcasts were a thing. It was during my internship, I guess. And I was on a podcast with a shock trainer. And at that time I was living in Pennsylvania. So that must have been my residency. And I would hike in the woods with these two Rottweilers with buckle collars, right? Deer everywhere. Yeah. And he was trying to say how tough he was. And he's like, well, you can't train off lead work without a shock collar. And I was like, dude, I hike with two Rottweilers and a bunch of deer. And I've never used a shock collar on either of them. And when I call those girls back, they come back. Like, they come running back from wherever they are. So, once you've seen the bottom and you turn it around, you're like an evangelizer, right? Because you know the power. And that's how I felt when I was like 21 or 20, and this happened to me. It's a long story, but there you go.
No, that was a great story. I was really touched about how that the people around you, after you gave a forceful correction, laughed at you. And I think that really underscores a lot of the part of our culture that tries to normalize this treatment of dogs. And like, you're the weird one for having feelings about treating this animal, in this way, and wanting to be able to treat your dog in a better way. And with you being so young, because I mean, that's That's the thing. We don't know what we don't know until we know it, right? And you're obviously a very highly educated human in the field of animal behavior. So I think that's really valuable having someone like you kind of talk about that journey and the catalysts that help you turn it around a little bit. That's very moving. I'm wondering if you can tell us a bit about your specialty and why veterinary behaviorists are particularly qualified to understand how different training methods impact dogs' mental and physical health.
Yeah, so we start out as veterinarians, right? So we're trained in medicine, not just medicines like you take them, but medicine, diagnosing, treating, physiology, all this stuff, right? So then you do an internship, that's usually a general medicine internship, and then you do a residency. So the residency consists of the pieces and parts of that. So how do physical diseases or disorders affect behavior? How do medicines affect behavior? Not just like Prozac, but like how does prednisone affect behavior? So there are 2 studies showing that corticosteroids as a drug class, so not just zearalenone and prednisone, but dexamethasone, betamethasone, how do they affect behavior? Well, we obviously know, for example, that those medications affect appetite, right? Affect drinking and eating, and then thereby affect urination because they drink more. But also, we know that they reduce resilience in dogs when faced with aggression. So if a dog hears another dog growl through a speaker, dogs who are on corticosteroids are less resilient. They are less likely to approach that speaker where the sound came out of again. We know that dogs on corticosteroids are more likely to exhibit certain types of aggression, like aggression over food. So we have to know that stuff, right? And then we also have to have an understanding of learning theory that is deep enough that it's not applied to dogs only, it's applied to everything. So on the boards, you're going to have to learn about like antelope, which we might argue that's not necessary, but we still have to learn it.
Mm-hmm. Yeah, pointing out that even if your dog never needs behavioral medication, you've made me realize how so many of us don't even think about all the different medical treatments any dog may get throughout their life and how important it is to really pay attention to that and not just think about the disease you're trying to help or, whatever's going on. That's such a good point. That's really interesting.
Yeah, and particularly, and you can tell me if this is true or not, but there are, I don't know, let me just ask you, what percentage of aggression cases are an underlying medical condition? Are you able to
so
ballpark?
aggression in particular.
Yeah.
Well, so we could, so that I'm sure about that one study that looked at 6 different behavior centers across the world and surveyed the vet behaviorists and said, how many of your cases, just across the board, go back through your cases, how many of them did you suspect systemic disease? How many of them did you just suspect orthopedic disease? And then which of those were confirmed? So the numbers that came out of that. So this is global, not just US, which I think lends credence to like how important it is. So about on average, 50% of all behavior patients are sick in some way, if I include pain as sickness. So they have some medical issue. So, I would say my clinical experience is that's true, that most of the patients at least 50%, maybe more, have something going on. And it's just so easy for us because we're living our lives and we can't log everything about everyone in our lives. It's so easy for us to miss those things. Like I just saw a patient the other day. He's so cute. He's a little fluffy white dog. And he started crying out when they would pick him up. So the recheck with me was when my boyfriend picks him up. And I said, okay, well, you know how this works. You start talking to them. It's not just the boyfriend. It's other people too, but it's more likely to be the boyfriend. So it's very easy for us to go, boyfriend bad, boyfriend did something bad, dog has trauma with men. But the more I talked to the pet parent, and when she sent me videos, the more I was convinced that this dog actually was painful here around the rib cage, which could be coming from the spine. So I think we have to be super careful because it's easy to go, it must be the boyfriend, when actually it just could be that the way the boyfriend picks the dog up is like baby under the arms pickup, which dogs should not be picked up like that, right? And the way the female pet parent picks the dog up is like a football, which is like my preferred method,
Hmm.
you know, to scoop underneath and ride up the side of the body.
Is that because it
So,
supports their whole body, basically? Okay.
yeah, and dogs don't fly. Like dogs don't fly. What is that, right?
Right.
So we pick them up and okay, every dog is going to be different, and some dogs will like to be picked up like a baby. We have to be aware of that. But most dogs, I will usually put treats in my hand, treats to the nose, scoop underneath, and they ride up my body, which means you also have to be physically able to bend down. And some people can't do that. They can't bend at the knees. So those dogs have to learn to go on a table. But I guess my point of all that was like, assume that your dog isn't well, and then we'll go from there.
Yeah, really well said. The stigma that goes around medications, particularly in the dog training field, it's very problematic how medication and treatment is often looked down on amongst many dog trainers as well. That's something that needs to change in my field that I can tell you about. But yeah, it seems to be a real issue because medication is so necessary and can help so many, not just for behavior, but to address underlying other medical conditions, right? That might alleviate the
Yeah.
pain that's causing aggressive behavior in some cases.
Yeah.
You know, we kind of talked about this earlier, and even when you were talking about it with me in the stunt dog world,
Yeah.
many trainers really rely mainly on rewards and punishment, what we call operant conditioning. And you made the very valuable point earlier how classical conditioning is involved with that at the same time because you can't remove the environment or anything. But we don't have to get into too much of that technicality right now. But what would you suggest trainers consider to better understand and respect dogs as emotional and social beings rather than simply trying to extract a physical behavior, whether that's with positive reinforcement or positive punishment? I mean, I guess what I'm getting at, do you see problems with the operant conditioning model even with positive reinforcement? Or have you given that a lot
Um,
of thought?
I see, I think that there's different levels of trainers, just like there's different levels of veterinarians and everything else. And I think part of the main problem I see is that human beings, pet parents, and I think sometimes trainers too, feel that they have to know everything. And I think we should really feel comfortable referring to each other. So there's teaching a happy dog who has no underlying emotional challenges to sit. Okay, that's a thing. And that's not such a hard thing. But then if you have a dog who is anywhere on the outskirts of the bell curve or is actually off the bell curve, that becomes more challenging. And I think I'd like pet parents to start thinking about skill set. That dog might need a different dog training professional, right? Because no matter what training method you utilize, you can mess up. First of all, we're all going to mess up, including me and you, and we have high skill sets. I'm pretty cocky. Like, bring me a dog. I can bring me a cat. Like, you feel a little cocky sometimes when you've been doing it a long time and you're good at it.
Mm-hmm.
I screw up. I reinforce at the wrong time sometimes. I click at the wrong time. I miss an opportunity, whatever. Like, everyone's going to screw up, right? So what I would like for people to understand is it's okay to not know everything. So if someone comes to you with a dog that you can't train, your choice is not to put a shock collar on it because you don't know what the heck you're doing. The choice is to refer to a trainer who does. And by doing that, you will lose the income from that client. That is true. But I, at least, really respect a doctor or a professional who says I'm out of my lane, because I would rather than not go rogue with one of my family members. If I have a doctor who's never done a surgery, I'd rather them not try for the first time on my child, right?
Mm-hmm.
Okay, so I understand dog training professionals, just like veterinarians, have to learn, and I also understand that if my pet is having a problem, that's not the time for you to learn, right? So the first thing I want to say is there are different skill sets for dog trainers. That's okay, because it's just like every other profession, and there's no shame in that.
Mm-hmm.
And pet parents should ask for a referral to someone else if they feel like they love this dog trainer, but they're outside their skill set. Okay. Number two, I think we have to stop thinking of dogs as robots. We just need to do this simple thing: apply the same standards to dogs that we apply to ourselves. Because, at least from my viewpoint, what I see my pet parents doing a lot of the time, not everybody, and what I see some dog training professionals doing and some vets is thinking that dogs don't feel. Like, I don't know what, it's so absurd, but dogs don't feel, or they don't have the same emotional processes, or they should be able to endure more. For example, we all have personal space bubbles, and I think in the past decade, especially women, have come to the forefront saying, you don't have the right to touch me, right? Even though you think you're being kind, like you need permission to touch my arm or to touch my shoulder or whatever, right? But even though we fully accept that as women, when our dog approaches someone, we think that someone should be able to touch our dog. Like, it's so weird to apply that standard to an animal who can't think as highly as we can, but yet we don't apply it to our child. God help the man who would have tried to touch my daughter when she was little. It would have been full on mama bear, full on positive punishment. I would have raged all over them, right? But yet we let people pick up our puppies and pet our dogs. It's a very weird standard. So I think if we just stop and go, if that was me, what would I want? I think automatically we will be on a better path.
Right. Yeah. If only it were that simple, but that is a good guideline. I mean, if people find this overwhelming to understand this topic or feel like there's so many sides and they're confused, I think that's a good way to find their guidance and find their North Star on this, really, because that's,
Yeah.
yeah. I mean, I say something similar to my dog training clients and my viewers on YouTube and everything, which is, how would you treat a 3-year-old child if you were trying to help them learn a new skill, and so that's kind of the standard that I've always had in the back of my head when I'm working with a dog and try to retrofit it with a dog somehow,
Mm-hmm.
Oh,
Yeah, and I think that's the key. And that's what I tell, if I'm sitting with a married couple, if there's two people who are in a relationship, you can almost always use this analogy, I think, for me. So I was with a couple the other day that they'd been obviously married a long time, and they have this dog, medium-sized dog, who is reactive, as so many dogs are. It's a pandemic, really.
Mhm.
And so one of the partners says, well, I don't know why we can't just use a shock collar. And I said, no worries. No worries. When your wife is yelling at you, we're going to put a shock collar on her. We're going to shock her. What do you think is going to happen? The husband was like, no, I'm not going to do that. No. I'm like, right. What do you think is going to happen when she's already out of her mind, scared or angry, and you hurt her more?
Right.
So when you put it in that way, people are like, oh God, never would I ever. So why are we doing it to dogs? I don't understand. Like,
Right.
it doesn't make sense.
Yeah, and that's exactly it. I think most people are more rational than most professional dog trainers. I say most professional dog trainers because, unlike your profession, we're in an unregulated profession. So we get a lot of amateurs in this profession who don't rise to a certain standard. And that's not meant to judge. That's
Right.
just meant to alert the public that
Yeah.
they're dealing
Yeah.
with. That's all.
Yeah.
I thought that analogy was really profound.
Really good, yeah.
As someone who grew up female, right? I had never, I'm familiar with the feeling of still, in some ways, being treated like property, right? And because we have like this patriarchal society. And so we all still
yeah.
feel it, even in 2025. Wow, in one way or another. There's a dog hair, sorry. Like a huge tuft just came up. But I had never really put those two thoughts together, like that it's annoying to me that people still feel like they have the right to my body in terms of at least like a harmless physical touch that they maybe wouldn't do to a man,
Right.
I had a man pat me on the cheek the other day and I was like, who are you? Like, what do you think? I know, it was so weird. But I had not like made that connection to people feeling entitled to our dogs, who are viewed as property right now, at least in America and maybe worldwide. I'm actually not sure.
I don't know. That's a good point.
That's interesting.
Yeah.
I thought that was a really good analogy.
Yeah, I think that we are very interested in, I want to be scientific, but I also want to meet people where they are and let them know, dude, I get you. And when people say, when I try to explain to them, your dog's afraid or whatever, they're like, and I'm like, don't you feel afraid sometimes? Like, yes, but I don't bite people. And then I say, okay, here I am, Joe Professional. I was at a big event. The person sponsoring me is standing there. So they forked over money to bring me there, to do the speaking and the whole deal. So here and I was wearing a strapless jumpsuit. It wasn't sexy. It was just happened to not have straps. I was fully covered except for so they were going to video me. So the guy, the video guy, the camera guy, cinematographer, I don't know, whatever he's called. He comes over and he takes my shoulders and he positions me. So I like pull away. So that's the dog baring his teeth a little. That's what I tell them. I pull away. Then he takes the clip-on mic. Bree, you're going to die. You're going to die. And he goes to clip it into my strapless jumpsuit.
Without asking, may I?
No. So I went, hey, like loud enough that my sponsor turned around. Everybody turns around, like, hey, you cannot touch me like that. Right? That was pretty aggressive. I was loud. And when I tell women that story, they go, oh, I get why my dog bit that person. Now I understand. I'm like, yeah, right? Did I overreact? I don't think so. Did I react loudly? Yes. I went to my sponsor and I said, that just wasn't okay that they touched me. And I wish it hadn't been that way. And she was like, oh no, I got you. Like I saw what happened. And that man was innocent. He was not trying to intimidate me. He just didn't know the rules, right, of how you interact with women. So I guess my point simply is, every time we look at a dog and we go, why is he blah, blah, blah? If you just look at yourself, you've done the same thing at some point, or someone you love has done the same thing, right? I think that is the key, going back to Zach's question 15 minutes ago, which was like, how do we get dog trainers and human beings to see dogs differently? Just see yourself in the dog, right? And you will see the whole thing differently.
Yeah, well said. Well, so what ethical responsibilities do you think dog trainers and behavior professionals have when advising the public, especially regarding training methods? So, in other words, what should trainers prioritize to truly put dogs' welfare first? Like, you've kind of been answering that, but do you have any additional things to say about that?
Yeah, well, trainers are unregulated, as you said. There are many, many very good trainers. I have lists of trainers from all over the country that I refer to. Of all different skill sets, but committed to force-free. And so I think what trainers should know isn't what they have to know. What they should know is some physiology. Because when there's no doubt from rats to human beings, from bumblebee, whatever, maybe not bumblebees, but definitely mammals, when you teach something, you change the brain. That's not up for dispute, okay? So I think there should be some level of physiology that trainers should know if they're going above obedience level. So if you're just teaching a basic obedience class or a basic puppy class, I think you have to understand how to identify atypical or abnormal. That's what I think you have to know. And then you have to know basic operant and classical conditioning. If you're going to now look at the abnormal and try to treat it, you've got to understand physiology to some extent. You've got to understand the role of the body systems in changing behavior. I think that you have a responsibility to understand the latest science. And let me just be clear, that ain't easy, because I spend my time staying up to date on veterinary behavior, but that means I don't understand flea control. Like I literally had to purge things from my mind that I cannot stay up to date on. That requires you setting your ego aside. Let's say you're going to treat separation anxiety. To stay up to date on that research, you might have to not be up to date on the latest ways to train a dog to go through the weave poles and agility. Like there's that, right? So I think you should understand operant, classical conditioning, physiology. And I do think on some level, dog training professionals should learn about how to communicate with people, how to make your point in a way that's non-judgmental. And I'm pretty straightforward. And sometimes I got to check myself. I had to just, in the exam room just last week, I wanted to say, and I just said, you guys are giving me a heart attack, because they keep taking this biting dog out to like farmers markets. And so I got my point across and we laughed about it, and I still got my point across. Like, I think those are the things that I think about. It's not just training. You have to be able to communicate with people. Right. You have to be able to persuade people without being a jerk, you know?
Yeah. Yeah, I agree with that as well. And and I think like being able to communicate with people, because again, I have two buckets when I'm talking about this topic and trying to impact the industry. I have two buckets. I have professionals and I have the public, and my point is, once you start taking money from the public and passing yourself as a professional and you're shocking the public's dogs, like those, in my view, that does require firm words from other professionals to call that out. Again, when we see civilians doing this, that is a completely different issue. These are people who are not trained or claiming to be trained in behavior science too. So I don't know how you feel about that or not. We sometimes receive criticism for being harsh with those passing themselves off professionals and shocking the public's dogs. You know what I mean? So I don't know. What are your thoughts there on how you think that could be better done without just totally alienating people, but at the same time not being tolerant towards violence towards dogs in the name of professionalism, or violent towards dogs
Yeah.
in the name of professionalism?
So I think we all are going to approach this in our own way. So I was just with 3 of my girlfriends on a girls' trip. We're all about the same age, really own businesses, have kids, spouses. And we all approach feminism differently. I am radical feminist. Like, I'm the most radical of all of the 4 of us. And we all feel our own power. We're all supporting of women's rights, and we do it differently. So I think you probably need people all along that spectrum fighting in every different way. So for me, my primary way of fighting this huge problem of shock, primarily because I think that it's easier to sometimes in my experience, it's easier to get a dog past trauma from a pinch collar. The trauma from shock can be insurmountable.
Okay.
It's like I tell people, once you shock the dog, you're making it really hard for me to make this better. Because once you suppress warning signs, I could be fast enough to catch your dog before they blow in order to intervene. But I don't know that you will be, right? So what my approach is, educate the pet parents, because the pet parents have all the power. They have the money. Shock collar trainers don't exist without credit card. They don't. Mm-hmm. And the pet parents are the one with the credit card. So I am coming at this the same way I come at fear-free. I do educate veterinarians, but I go straight for the public, because if a person walks into a trainer or walks into a veterinarian and they hold the money, they hold all the power. So I teach pet parents where to go and what to do. Pet parents who come to me here, I cannot work with you if you're going to continue to use that trainer. It's okay. You can go see your vet, but I can't do that. So they are hearing that in that way. I will speak to almost anyone. I'm not interested in going into battle. I'm not going to go into battle about women's rights. I'm not going to go into battle with a shock collar trainer and try to persuade them. The science is there, but I will speak to almost anyone who's reasonable and have a reasonable conversation. So there is a shock collar trainer in my area, and I call it shock. Let me just say, he's brutal. Like, he's banging on cages with his fist, and he's brutal. And there's a rescue that I work with that he usually starts their dogs, and I get the dogs when he's long gone and they have behavior problems, not only because of him. I'm not implying that, but so the rescue organizer, who I really adore, said, "Hey, will you speak to this person? We'll just call him Joe." And I said, "Yes, I'll absolutely speak to Joe." I actually had a lovely conversation with him. He's a father of 3. He loves his babies, which connects human beings everywhere. Moms and dads love their babies, right? So we talked about our kids. I made a folder for him in Dropbox, put a bunch of literature, shock collar literature in there. And I said, more power to you. I'm not interested in arguing that point, but I am interested in sharing and connecting. So that is my method. Go where the power is, and the power is with the money, and that's the pet parent. That's the bottom line. And when they start demanding different, I promise you, when pet parents stop going to shock collar trainers, all the shock collar trainers will be using treats. That's it.
Yeah.
Because if you can't make money at it, you're not going to do it, right?
You're so right.
Yeah.
Well, yeah. Going to the public that's always been my strategy as well. Just going straight to them and trying to, in good faith, present the data on the topic, and free from spinning or any of that.
Well, and there is such a big difference in the dog training field between the trainers who are using shock collars, etc., who are just indoctrinated, like just don't know better and grew up that way or feel like it's right or whatever. And maybe when they hear that there's a whole bunch of evidence that shows that might not be the best way, they at least feel doubt, you know, and at least a little question mark starts to form in their brain. And I think there's a huge difference between those people and people who hear the evidence and are like, nah, I've been doing it this way. I know it works. I know these dogs in front of me are doing their perfect little heel or whatever. And so not interested. And I think that's where the harm really starts to happen in our industry. And it can be hard sometimes at first to differentiate between an open and a closed mind, right? So we've got to be careful and try to talk to everybody, but also not get bogged down. You're right, with battles that...
It's a fine line.
Yeah, there's only so much we can do.
Yeah, I like to know who I'm dealing with when I'm talking about this. Am I dealing with someone with an open mind, or am I dealing with someone who's hell-bent on upholding the status quo of punishment, not only in dog training, but likely throughout our society? I mean, honestly. But that's my personal 2 cents.
Yeah. Mm-hmm. Yeah.
I was very surprised as a person who didn't expect to join the dog training industry. Like, I'm an animal lover. I like biology. I didn't like plan to become a dog trainer, but now I'm with Zach and I'm very interested in it now. And I was just shocked how this industry is. I was shocked how many people there are who will genuinely hear that there's a better way and not care. You know what I mean?
Yeah. Like
the person first mentality in dog training is so interesting. It really surprised me.
The person first. I want to talk about that too, actually, because there's this talk, because, I have to deal with a lot of so-called balanced dog trainers or whatever who are really trying to keep the status quo exactly where it is. And one of the things that they will say is, well, look, choke, prong, shock collars are so widespread. We need to focus on harm reduction by showing people how to use these devices more properly, right? This has the illusion of reasonable, like, oh, we're just trying to meet people where they are. I show up at their house, they're using a prong collar. Rather than having them use it abusively, let me show them how to use it in a more humane way. What is the pro or con to that? Do you have any thoughts on that?
Yeah. So I understand the concept of harm reduction. And for those people, like, harm reduction is this phrase that people might not know. So that just means like reducing the negative consequences of any treatment. So in medicine, we'll say harm reduction, thinking about maybe chemotherapy, right? So we're going to use the drug that will have the least consequences and will still be effective. So maybe if people don't know what that means, they have a general idea. So so I think that number one, it's inefficient because the time spent teaching people how to use a prong collar effectively could be teaching them how to use a positive reinforcement method effectively. So it doesn't really make sense to me. I do understand, though, the concepts of what that person is saying, because the little bit of science we have looking at how punishment tools are used points to, at least in dogs, that tools that are used kind of willy-nilly or randomly, which is the way pet parents use them. Whether we're talking about a clicker or a shock collar, they use them randomly, right? Those, not a clicker, but the shock collar specifically, causes the most stress. So the most physical stress, changes in body temperature, heart rate, respiratory rate, are when the animal doesn't know why the shock is coming, right? And so I understand what that person is saying. That person is standing on like the head of a pin. They're wavering. They're curious. They know that what they're doing doesn't make sense for their core values. They know that it's damaging, but they don't know where to go. That's the person I want to grab onto and say, let's talk. Tell me what you're afraid of, because everything you want is on the other side of fear. You want to use positive reinforcement, but you're afraid that you're going to have to shut your business down while you learn how to do that. You're afraid that you own this training center and how will you pay for it? You're afraid that you won't be good at positive reinforcement because you're in your 50s and you've trained punishment. Like, everything you want is on the other side of your own fear. So, number one, it's inefficient. You could just use the time that you use teaching them how to use a shock or pinch collar, teaching the people how to use food. And if we're talking about harm reduction, using the treatment that is just as effective or more effective with the least amount of negative consequences, then you aren't exercising harm reduction by teaching someone to use something that has adverse events associated, like a shock collar or a pinch collar. So I understand their mindset. I think they're being curious. I think they're ripe for the turning to learn a new way. And also, it doesn't make sense. Yeah.
I agree with that. That was so well said.
Yeah, right. Yeah, the false branding of harm reduction. It's not really harm reduction, is it, when we're creating harm?
Yeah. And also, we have to really think about, does the person teaching, okay, so I told you guys this story before we started, and I'll try to keep it brief.
Sure.
I work with my patients, like I physically train them when it's necessary. Not every time, because sometimes some of these trainers way better than me, right? So why would I handle the dog? But sometimes we have a good trainer on board, and also the pet parent for some reason isn't grasping it. So I will work with the trainer and the pet parent. So this happened the other day, and I was handling the dog. And just by changing the timing of the reinforcement, we went from reactive in 5 minutes into walking into a pet store. It was 5 minutes, if that, because it's Florida. You can't be outside that long. So, right, and I went from training the dog, myself, reinforcing the dog, teaching the dog, the pet parent teaching the dog, and the pet parent walking in the store. So my point is, sometimes it takes a very high skill set. So then the question is, with that method of harm reduction, in air quotes, is the shock collar trainer that's teaching them how to use the shock collar with the goal of harm reduction that good? Are they that good? So did they really know how to use that tool? Would I hand a scalpel to a client after I demonstrated to them how to make a midline incision for a spay? Like, how much danger and harm can be caused by the tool you are handing out? And in medicine, this feels very real to us. We prescribe controlled substances like Valium. And I say to people, are there any teenagers in your house? Are there any little kids? One of my clients, thank God, they felt comfortable enough to say, we are in, and I hope I don't insult them because I can't remember the words they used, but they had suffered from addiction. And they used specific words, and I'm sorry that I can't remember those, and they said, we cannot have these drugs in our house. So we are very used to, in medicine, harm reduction, right? Being careful about what we use. And we don't hand out to people. I didn't insist that those people take a controlled substance home, right? Because it could be harmful in their life. And so we don't want to hand off to people things that can do harm. That doesn't even make sense, you know?
Yes.
Yeah, well said.
Can I just ask, I know that you've trained a lot of Rottweilers, right? And other large dogs. But I know Rottweiler's one of your breeds that you've trained a lot of, right?
Yeah.
So I haven't seen you in person, but you seem like maybe the Rottweilers may have outweighed you. Possibly.
I'm little.
I'm just curious, talk to me about leash pulling and stuff. How do you convince your clients who come in with a giant dog
where they physically have a hard time controlling them?
Yeah,
right.
That even somebody like you or me could do it. I don't know. Do you see what
Yeah. So I'm pretty pragmatic. So when I first when I first learned about positive reinforcement, so I changed with Precious what I was doing from pinch to positive. So then I got Sweetie, and I had to teach her to heel. And it's an old method. It's called Choose to Heel. So basically, you're off leash with your dog, and very old, and you have food, and it's on you, and you walk in a circle. And each time the dog finds you, you reinforce. And eventually, of course, that dog is walking in the circle with you, right? So then you get your buddy to bounce a ball, call the dog moves to the person holds their treats, dog's jumping, they sit still, dog chooses to come back to you, you reinforce. And of course, there's differential reinforcement. Whatever they have, is 20 times better. So that's how I taught Sweetie to have that attention healing that I needed in the obedience ring, that jacked up, I call it, where they look like they're prancing. So, that is the method I've stuck with. And not every client has a yard. Not every client can do that. But I think what we keep forgetting is reinforcing what's right. And that's all that I did with that reactive dog with the pet store. Is I just went, now you're right. It's now, right now. That's it. It's now. That's it. It's right then. And the dog was like, then? And I was like, yes, then. And then all of a sudden it was all I got. Like I was tripping over her because she was jacked up. So when I talk to people about that, I'm really pragmatic. First I say, why do you have to walk your dog? You have a yard. Well, I have to walk my dog because that's what I'm supposed to do. I'm like, no, I'm going to absolve you. There's your rights, right? No, don't walk your dog. Put him in the backyard. play with the ball, let them swim in the pool, do your thing. Like, okay, wow, all right. Well, I have to walk my dog because that's the only way I get exercise. Okay. Now we have to talk about that low sitting waist leash. The Serracalni is my favorite. It's like really thick and it sits low on your waist and has a giant clips. Let's talk about a no pull harness, one that does not cut across the bicipital tendon here. Let's talk about all the different ways we can help you get leverage, but you must know that that is not going to stop your dog from pulling. That's the key, and it says it like in the language of the handouts that I write, like that is not going to stop your dog. You're not going to have enough leverage if the dog is 120 pounds and you, like me, weigh 98 pounds. I can't give you enough leverage. At some point, if that dog has enough momentum, he's going to pull you down. So the money in the piggy bank is the reinforcement of what's right? So that's what I try to tell people. And I ask them to stop putting their dogs in situations where their dog is going to fail, because that's what they do. And then the dog practices failing, and then failing becomes a habit, and then we're in a hot mess, right? Mm-hmm. So I recognize it's dangerous to be pulled down. And I also recognize that dogs can be exercised in the house. In Florida, it's almost a necessity. It's so hot and humid here. And that they have yards, and they don't all have to be walked either. And if you want to walk your dog, so I told my client the other day, I said, you're asking a lot of yourself and the dog. Let's recognize that you are outside of your skill set and that you are trying to do PhD level work with a dog who is in first grade. And frankly, you're in kindergarten. So I just want to be real clear that I am saying you don't have to do this. And I said, do you still want to do this? And she goes, I'm in. I said, okay, if you're in, then here's your go purchase list and here's what we're going to do. But I think we first have to say to people, you don't have to do that if you don't want to do it. It's okay. Your dog will be healthy,
Mm-hmm. Yeah, exactly. And also related to that point too, I think more people in the public and dog trainers for that matter need to understand that like positive reinforcement, it's dose dependent, right? I mean, it's not, you're not just going to get a few reinforcement opportunities and then voila, right? I mean, I reinforce my dogs to this day. They do the behaviors I like. I still reinforce them because the more I reinforce them, the better it's going to continue to be, I guess. Is that right?
Yeah. What is the problem with just being nice? Like, I don't understand. Like the other day, my husband picked me up from the airport and he brought me, I love these fat blueberries. They're really fat, like bigger than my thumb. Mm-hmm. And he brought me a little plastic container of the fat blueberries because when I talk to him, I'm one of those people who's crazy about food. I go to the grocery store when I travel and I put it in a little hotel fridge and I eat my carrots and stuff and whatever. So he knew I was out of fresh food for my travel home and he brought them. I thanked him in the car twice. The other day I said, what you did, I just thought that was so sweet because you brought me the fat blueberries. So I guess what is the problem? Should I only have thanked him once? Why can't I thank him 3 times? It was really nice, right? And I thought to myself, the more I thank him, the more he'll know that I love that. And don't I want him to know that I love it? I just get so confused when people don't want to reinforce their dog because it's just like common sense to me. Why wouldn't I? When my daughter does something nice, she's 17, so much is not nice. But when she does something sweet, I'm like, oh, Isabella, thank you so much for emptying your lunchbox. She's like, Mom, whatever. But shouldn't I thank her? Right? Like, I don't know.
Mm-hmm. Yeah. Well, and I have a lot of thoughts on that too. And it's obviously multifaceted, but I think a lot of it points to our culture. We shouldn't have to, we feel entitled to behavior from our dogs or many, people in our culture do. And I think that's one of the things we have to address. If we don't change culture, we have a hard time changing this issue in the animal care field. And it's a lofty goal. So yeah, I mean, for trainers or guardians listening right now who want to move away from aversive methods towards the compassionate methods you've been talking about, what are some practical steps they can take?
First of all, set the bar low because you're learning something new. And it's really, really, and I know this from training baby doctors because they come in as hot shots from their internships. Mm-hmm. And they come in here and the first 3 months, they're like, Dr. Radosta, I don't know anything. And I'm like, you know so much. But it's really hard to be a hot shot and then go back to being a learner. So first of all, set the bar low. Second of all, start by shadowing someone you respect. A lot of trainers some may feel threatened by you, that you may be competition to them, but many trainers, at least in my area, are real open. Like maybe you could shadow them and watch them in their classes and get a feel for how they navigate some of the problems you're treating now with aversive methods. And I just did this with my client who, he's like one of the most amazing pet parents. He's training his dog and he's so committed to the dog, and he somehow just got sucked in, as we do, with a trainer that didn't know what to do. She was outside her skill set. She put a pinch collar on the dog, and he wears a camera all the time, like when he trains, so I can watch the videos. I just love him. And anyway, so we saw the whole thing happen, and he and I walked through it. We did a debrief on it. And when I connected him up with a positive reinforcement trainer, that was like enlightening to him, that he could teach the same skill and not do it that way, right? So first you're going to shadow someone you trust, get a feel for it. Then you're going to have to decide how you're going to acquire your education. And that's really hard because places are all over the place. So you might choose to get the certificate that you guys got, right? So you might choose to do that and kind of immerse yourself in the learning of the theory, which I highly recommend. And then maybe you could get a certification like KPA or something like that, where you're hands-on and you have to prove your hands-onness, right? There are lots of other places besides KPA, but you want to start with the basics of watching someone you really trust, I think. Then you want to immerse yourself in the learning theory, and then get with a program where you can use your learning theory in real time. And don't be afraid to say to your mom, like, I want to train your dog to do some stuff. Like, experiment on family dogs before you take money for what you're doing. Because when you take money for what you're doing, we're back to fear. I really want to do a good job. Oh my God, can I do it this way? I don't really know what I'm doing, right? So practice on your friends' dogs, on your own dogs, your cat. If you can't train a cat, you can't train a dog. Okay, so practice on other animals, and don't be afraid to ask questions of your community.
Well said.
Yeah.
Well said.
Such a good answer.
Yeah, absolutely. Dr. Lisa Radosta, we appreciate your time today. Thank you so much for everything.
Yeah, where are the best
Thank
places to follow you? I know you have a couple of books that you've co-authored that I personally recommend.
Thank you. Thank you. They can follow me on Instagram. It's my name, Dr. Lisa Radosta, on Instagram, Facebook, LinkedIn, and YouTube. YouTube, we really put mainly up one video a month that is long form. So do your dishes while you're listening to it. So it's like 6 or 8 or 10 minutes where I go deep. So I've been doing stuff. I did a territorial aggression. This month is a possessive or aggression or resource guarding. And then the things that are on Facebook and LinkedIn and Instagram, of course, are shorter. So yeah, that's how they can find me.
Thank you so much. Yeah, you are making the animal care world a better place. We really appreciate everything you do. Bree and I learned so much.
Thank you.
Right back at you. Thank you.
The world needs to know about this food. I have fed my dogs every day for years, and then comes along the most innovative dog food I've ever seen. So many people are interested in the raw food diet for their dog. However, there are legitimate safety concerns. Enter Pupford's Good Dog Food. What's really special about this food is that they use a non-thermal, FDA-approved kill step that removes pathogens without cooking the food. That leaves all those nutrients, all those vitamins undisturbed. And that outperforms typical high heat freeze dryers. Look at the ingredient list of this versus other dog foods. Things like blueberries, spinach, pumpkin, carrots, beets, and cranberries. The question fast becomes, why am I not eating this food? All of these are great for immune health and digestion and that shiny coat we're all after. This food comes in many formulas too. You can use it at all life stages for your dog. Beef with organ meat, lean chicken for digestion and more weight sensitive dogs, salmon and lamb for omega-rich skin, coat, and immune system. But the thing I appreciate most is that it's got the convenience of kibble with the quality of high nutrition. Thank goodness Pupford has invented good dog food. Your dog's gonna love this. I'll have links below, and let me know what you think of it too.